Young Investigator Award. This award goes to, please put your hands together for Dr. Nanditha Arun.
Introduce the awardee and read the citation.
Friends, suffice to say that research, both in clinical and basic, forms the platform for serving the community in different areas, especially healthcare. And we, as you listen to Nithya Krishnan, I still remember the first abstract we wrote together in 1994. I had to send it to her. She has already gone to UK at that time. And Nithya alluded to that. So we have excellent scientists sitting here for research and giving us feedback on how to take care of the patient, including Dr. Ramachandran from the Ramachandran's Diabetic Center, and Professor Vivek Kute, who was one of the previous recipient of the KB George Award, and Professor Gopalakrishnan. And I don't think that the Government Medical College Hospital has ever witnessed so much research done and produced effects, impact on patients' healthcare. Gopalakrishna, you are an ideal example for many. Now let me go to Nanditha. The Nanditha Arun is an MD in General Medicine, FRCP Glasgow, and FIMSA and PG in Diabetic Diploma from UK. And she is a diabetologist at Dr. A. Ramachandran's Diabetes Hospital, Chennai. Founder Director, India Diabetic Research Foundation, Chennai, Tamil Nadu. And I just want to tell you that we have Ramachandran and Mohan, and the group says that we have 97 million diabetics in this country. And mind you that 1 in 3 diabetic develop kidney disease. Every day, even today, I am seeing people who are suffering from diabetic kidney disease, and we are helpless in front of them. So, are there new molecules or drugs which can slow down the progression of diabetic kidney disease? We are just trying our level best. I was just telling here, and is there something which could happen from heaven? Tell us that, okay, there is a miracle, you just work on that so that you could save the life of these patients with diabetic kidney disease, whom we are losing miserably because of the condition of diabetes, which has progressed and affected every tissue in the body. I always tell patients that a 70-kilogram person has about 60,000 miles of blood vessels in the body. Anywhere you prick, it is blood. So all these blood vessels are circulated by blood, which has a very high blood sugar. And we are not sure about that. Only 47%, nearly 47% of the diabetics in this country do not know that they have diabetes. And among them, those who know, only 25% have adequate or some optimal diabetic control. So where are we heading? So this is a big problem for us. So Nanditha has produced looked at a molecule which is called the SGLT2 inhibitors. This diabetic drug works through the kidney, not through anywhere else. So kidney doctors are also important to know that how this drug works. And she has looked at, in the Indian context, how this drug is effective. And she has looked at it longitudinally. So I would say that she is, to her credit, conferred fellowship by the Royal College of Physicians, Glasgow, and International Medical Science Academy. She underwent training for healthcare management at the Indian Institute of Management, IIM Ahmedabad. Dr. Nanditha Arun is a member of several diabetes medical societies and has been an organizing member of many international conferences and several international publications and presentations to her credit, and is a co-investigator in many drug trials. Is also on the advisory board of various. And we were writing a book together. I called Nanditha, join us for nutrition in kidney disease. There is very little known about nutrition. Every day the patient will, can I take Kira, can I take that, can I eat this? So I'm not a nutritionist. I'm just a nephrologist. So we need to let them know that what is suitable for each one, whether it is in Kashmir, whether it is in Kanyakumari, whether it is in Gujarat, or whether it is in Imphal or in central India. So that book is being, now more copies are being printed, and Nanditha was very kind enough to write a chapter in that. So let me also say that Nanditha is an incredibly admirable model for a lot of people, women and men, to do research. And I'm just reading the citation. K.V. George Kottikulam Memorial Tanker and Kerala Kidney Research Foundation Young Investigator Award, Dr. Nanditha Arun. In presenting this citation, we applaud your spirit of enthusiasm and commitment in the path-breaking research you have done in diabetes and related diseases. Your paper on sodium glucose co-transporter 2 inhibitors in patients with type 2 diabetes, a longitudinal observation study, has shown promising results with significant improvement in cardiovascular outcomes, especially heart failure in patients with or without type 2 diabetes. Also that these drugs help in reducing high blood glucose without the risk of developing low blood glucose. Your work has given life and hope to people who are battling diabetes and all the terrible effects on all other organs. You have presented and published several research papers in national and international forums and journals respectively. We salute your enthusiasm, hard work, commitment and achievement in one so young and look towards you for more answers. Thank you for being with Tanker.
May I request the awardee to say a few words?
Sorry, I need to remove my mask for more clarity. Honorable Minister, sir, Madam, Professor Georgie, senior delegates present here this evening. Very good evening, ladies and gentlemen. I am so happy and honored to be receiving this prestigious award this evening. And if I can just say, this award is always going to be very special to my heart, especially because it is from Tanker Foundation, and to be part of such an inspiring evening, to see how much of wonderful work is going on, and I've been witness to it as well over the years during my student days with Professor Georgie. I just need to take a couple of minutes to thank all my teachers. I've been blessed with wonderful teachers, but of course, among them, the one person who has always been almost like a father figure to me, my mentor, my guide, always is Dr. Georgie. Sir has been a constant inspiration for me. Right through my UG and my postgraduate days, and still continues to be so. He's been an inspiration in every way. So his passion and the compassion and the personal touch that he has with every patient that he attends to, I have been witness to that. And his depth of knowledge, his commitment to excellence in everything that he does is absolutely commendable and has always been an inspiration. I'm always proud to say that I am a student of you, sir, and I'm so grateful to you. Of course, I would not have made it this far, and I wouldn't be here today, quite literally, if it wasn't for my father, Dr. A. Ramachandran, who's there in the audience. And he, of course, has been my role model. His dedication, the discipline with which he works, and his passion for research, I think, has rubbed on to me somewhere. And if I can at least live up to an ounce of how much the standards that he has set in the medical field, I think I'd be very happy and proud. The 3 pillars of strength in my life, of course, first would be my mother, who has set an example with all her grace and poise with which she handles every situation, constantly encourages me. My husband, who is my biggest strength and my weakness, if I may say. And of course my father-in-law, who is also there, Dr. K. Raghavan. He is a retired professor from Madras Medical College, who I know I can always turn to. And last but not the least, my little sweet angel who's sitting there right in front, my little daughter who has been running around. Her name is Nihara. She's 8 years old, and I am very grateful for her, for all the joy and love she's brought into my life. Thank you so much.